Recognize Mary Joan Ladden. Mary Joan is the chair of Nurse Trust. Mary Joan, thanks for being with us. You want to say hello quickly?
Sure, I would love to. Hi, everyone. I'm sorry I was a little late. I was on another webinar. Um, I'm Mary Joan Ladden. I'm a nurse practitioner, former senior program officer at the Robert Wood Johnson Foundation. And little known fact here that Margaret Flinter and I grew up in the same town in Connecticut, in Waterbury area, Connecticut, and have known each other, and also went to the University of Connecticut School of Nursing for our bachelor's degree. So we've known each other for a long time, and she's wonderful.
Right back at you.
Thanks, Mary Joan. Really appreciate you being with us. One of the things that we always try to do is to make sure we're connecting, and sometimes humor connects people. There's a recent video that just came out. A comic who's 74 years old has a series of jokes that he shares, and one particularly struck me. He said he went to his physician to learn more about what he thought was his arthritis, and he said his doctor said actually he had early onset rigor mortis. So if you need to add a little humor to one of your meetings, that's a really good one. I'm Warren Hebert, and I run the Association for Home Health Agencies in Louisiana, and have the good fortune of having been in the Executive Nurse Fellows Program sponsored by the Robert Wood Johnson Foundation. We are excited to be gathering today. The gathering that we have, we refer to as trusted conversations. The intent is for us to have conversations here that you might not be able to have with a colleague, and conversations you might not be able to have with the person that you work for. So as we try to gather more and more different topics, we want to make sure that you understand at the heart of the matter here is for us to have these conversations that give you an opportunity to take some risk. So not only will we have Margaret Flinter's presentation, I'll introduce Margaret in a second, but one of the other things that we'll do later on is we break into triads, and we'll give you a prompt prior to the triad. And the intent is to give you an opportunity to not only engage in that trusted conversation with two other people, but also to deepen the relationships. One of the real benefits we have in Nurse Trust is that we're a smaller organization. So it gives you an opportunity to build deeper and closer relationships and not get lost as you might in a lot of other very large organizations. So building trust is really what we're all about. So what we'd like to do is to get your permission to do that. And if you would give us a thumbs up, that gives you all an opportunity to say, okay, that sounds good. And the other thing I'd encourage you to do, if you haven't already, is to plug your name in into the chat and let us know where you're from. Margaret Flinter is guiding us today. She was in the Executive Nurse Fellows Program. Margaret's got a PhD from Yale. And we're going to be discussing the work that Margaret has been doing in Conversations on Healthcare. She's co-hosted that with Mark Maselli for many years. The program brings national and global health and healthcare leaders on health policy, innovation, technology, and global health. It's a really unique opportunity that Margaret and Mark have to really drive some change and drive some innovation, because they are asking the questions and driving the conversation to some of these world leaders. She's been Senior Vice President and Clinical Director of the Community Health Center and is a family nurse practitioner by profession. She earned her bachelor's from the University of Connecticut, as Mary Joan said a little earlier, her master's degree from Yale, and also her doctorate from the University of Connecticut. She was a recipient of Robert Wood Johnson Foundation Executive Nurse Fellowship from 2002 to 2005, and in 2021 was honored with the Yale Jefferson Award for her steadfast dedication to providing healthcare services for those in need. Margaret, we just can't thank you enough for joining us today. and we'll turn it over to you.
Great. Well, it's my pleasure, and I'm sure that nobody says no to you, Warren, when you call and ask them to come join in with the Executive Nurse Fellows, and I'm no exception. I can't imagine saying no. I look at the invitations regularly and think how much I'd like to go to that, and then, like many of you, probably find the day doesn't allow you to do it. But it's great to be here. I'm going to call today. I don't usually say at 4 o'clock, wow, it's the end of the day or close to the day, but this has been a week where I am really ready to call this close to the end of the day. And I will tell you, in the last, just coming up on 24 hours now, my organization experienced a system-wide shutdown of all computers and all related devices, followed by an active shooter threat at a school-based health center where we have staff and where we care for kids, followed by what looks like was going to be a fire in one of our clinical facilities today. So I'm feeling like hanging out with you guys from 4 to whenever we finish up is about the most relaxing thing I've even contemplated in the last 24 hours, and I could not be more delighted to be here, and everybody's fine. Everyone's safe. The 3 crises all resolved. I know you all deal with crises all the time. So we're here to talk about conversations on healthcare, but as we all probably learned from Ida when you were in the Executive Nurse Fellows program, you know, when somebody gives you the microphone, you get to talk about whatever you want to talk to for at least a couple of minutes. So I thought I would take the opportunity, Warren, forgive me, to go off script a little bit and just do a little update on, you know, what I've been doing since the Executive Nurse Fellows ended, and really not what I've been doing, but how I and my colleagues have created change organizationally to support our mission of making healthcare a right and not a privilege, and not just any old healthcare, but really outstanding healthcare, and to do that through research, innovation, and training, as well as through the transformation of primary care. So the Community Health Center, Inc., that everybody knew me as the Senior VP and Clinical Director of, continues, but we, I shall say, in some ways, the children, created a parent over the last couple of years and created something called the Moses Weitzman Health System with this great byline, I think, always groundbreaking, always grounded. We did it very intentionally because we think primary care is in peril in the United States, and wanted to really put a stake in the ground that we're the first primary care system in America dedicated to underserved populations, and we're going to try and transform lives through patient care and innovations, as I said, in education, training, research, and accreditation. So you'll see both names, the Moses Weitzman Health System, and then the other organizations that we created over the years, which have Moses Weitzman as a parent. Next slide, Melissa. Thanks. And for those of you who just joined, I introduced a few minutes ago our team of supporters, Ryan and Melissa and CJ, who are helping us out today to try and make all the technology work smoothly. So when I was in the RWJ Fellowship, it was just the Community Health Center. But over the years and in the course of trying to solve life's persistent problems in access to healthcare, particularly for underserved populations, we had a lot of great ideas. A lot of them end up on the cutting room floor, as I'm sure you've experienced, but sometimes a great idea goes on to grow up and actually needs to become its own entity, though still connected to the mothership. And I wanted to flag ConfirMed, which is our e-consult company. We do e-consults for 4 to 5 million covered lives around the United States. That was our effort to solve the issue of access to specialists for underserved populations. The consortium, which supports the development of postgraduate nurse practitioner residency and fellowship programs, as well as combined NP and PA postgraduate programs. That was one of my key projects when I was in RWJ. NEMA, which is a national school for medical assistants, to really try and reach into the communities that health centers serve and recruit people perhaps for that first career ladder if they're not ready or interested in college at that point, and train them to a highly meaningful career, which they may continue in or change to another element within healthcare or their community. And the second project I had, because why do one when you can do two as an RWJ fellow, throughout my 3 years in the fellowship was to sort of conceive of and then put together and launch the Weitzman Institute, which is a research, education, and training division that is within the Moses Weitzman Health System. The other 4 are now subsidiaries of the system. So that's part of what we've been up to. And Melissa, if you'll pop the next slide for me. Just give you a quick overview of the Institute. It's now a full-fledged research institute from NIH to the federal grants to the philanthropies and so forth. We have about 60 staff. They're all remote, over a dozen states, prolific in their publishing efforts. I got the thing going, but they have taken it further than I probably could have imagined after those first few years that I got it up and running, and lots of publications, and invite you to take a look at the webpage. Next website. Next website. Next slide. Project number 2.5, when I was a fellow, was to propose the development of a new model for nurse practitioner education and training to follow the academic program with formal residency or fellowship, as people have often come to call it. And we launched that in 2007, and we have about 167 alumni, primary care and psychiatric mental health nurse practitioners. And our newest cohort just arrived last week. And for those of you who work with new nurse practitioners, I'm sure you had the same experience. It's just so wonderful to see a new generation of people every year choosing, could do anything, wicked smart, wickedly high motivated, and could choose to do anything, but they choose to become nurse practitioners, and we're so thrilled to have them here. So that's a piece of what I've been up to since I left the fellowship, and we'll do maybe one more slide on this. Postgraduate training programs nationally, quick update on it, hundreds, 221 that are NP only, twice as many joint NPPA, often in the acute care setting. And the Veteran Affairs has also developed this model, but community health centers remain the largest for the primary care programs. Next slide. Consortium also accredits those programs. Next slide. I thought I'd throw in just a couple of old photographs to say, yes, you really can do this work for 40, 50 years. I'm 50 years a nurse. So Mary Ellen, you must be celebrating an anniversary too. I'm 50 years a nurse. As of May of this year, 45 of those years I've spent at the Community Health Center, and that's just a few photos from our archives of the Community Health Center in our early days, including me the first year I showed up here as a primary care provider. Next slide. This is the health center writ large at this point. Community Health Center remains Connecticut-based. Moses Weitzman is national, but we deliver care to about 150,000 active patients from primary care centers, from migrant agricultural work sites, from schools, from homeless shelters, and most recently from mobile health units. And I'm sure you're all hearing a lot about street medicine, which has kind of taken on a whole life of its own as an additional resource in our communities. Okay, I think that's it, Melissa. We'll go on to the next slide here and talk about what Warren invited me to come talk about. So Warren, I hope that little trip down memory lane of from RWJ to here was okay. Just wanted to share some of that with you. All right, so we're going to talk about this, what was a radio show, now a podcast. And Warren, did you know that we were going to be celebrating the 15th anniversary of the show the week that you invited me to be on?
Wow, I did not know that.
I did not either until I started looking at the dates. But in fact, we're celebrating the 15th year of conversations on healthcare. And so I'm going to share a little history with you. And I have a little video clip. And then we're going to talk about some of the guests and some of the strategic issues that Warren asked me to talk about. But our very...
Margaret, Carl Jung would call that synchronicity.
There you go, synchronicity. The very first guest was Speaker of the House, Nancy Pelosi, which is ironic because I ended up going to a Nancy Pelosi event on Sunday. So this is my week to really think about Nancy Pelosi and Rosa DeLauro from Connecticut, who are best of friends and have served in Congress for about 30 years apiece. But Nancy joined us. It was rather low tech. She joined us by cell phone from the back of a cab on the way to the airport, but it was a great interview. And we also had a very good friend, Dr. Mitch Katz, who's the guy who had the original idea for those e-consults I talked about, and went on to be health director in San Francisco, and now I think heads up the New York Health and Hospital Corporation. So it was pretty interesting having Nancy and Mitch on that original show. Next slide. Over these 15 years, we haven't done a show every week, but we've done a lot of shows, 744 programs in total. Sometimes I look at that and I can't believe we did it. Some people were on once, some people were on many times, but they were all carefully selected. We probably get 20 or 30 emails a week from people saying, hey, I've got somebody, I'm representing, agents, I'm representing somebody who just wrote a book, et cetera. We'd like to have them on your show, but we do the proactive identification of who's going to be on the show, often really based on what is going on at this moment in time in our country, our society, or in the world. And it is produced by the team that I introduced to you. So big kudos to them. Next slide. We started our journey down this road, and you'll hear a little more about it in the video, on the campus of Wesleyan University. I don't know if any of you had anything to do with student radio programs when you were in college, the kind of a tradition on most college campuses, but it was a great place to start. And in those days, of course, it was just audio, no video. Next slide. There's I think we cut off the top line, but I did want to introduce to you, I would have introduced him in person, but he's on the last day of a vacation holiday and flying back to Connecticut as we speak. But the top photo is Mark Maselli, who's been my work partner, comrade, and colleague since the day I first walked into the health center as the National Health Service Corps scholar, to convince them that I was the person that belonged in Middletown, Connecticut. He's a tremendous innovator, tremendous entrepreneur, and thought leader, and I give all credit for the genesis of Conversations on Healthcare to Mark, although we've done all 744 shows together since then. And then on the bottom is Adam Shapiro, who is our professional producer of the show at this point. If anyone thinks doing a show like this for 15 years and 750 or so episodes can be done by a couple of people in their spare time, think again. Some of you probably have podcasts, and it's great to have a podcast, and I think you probably can do that solo, but the level of coordination, scripting, technology, nurturing the guests that you want to have on really requires a professional staff. And Adam Shapiro is a real pro. He's Washington-based, works closely with our communications director to make it all happen. Next slide. Okay, so I'm going to just play for you, which is the royal we, the studio people will hit the right buttons to play for you, a clip that we made, I think probably about 2 years ago in honor of our 50th anniversary, or maybe last year, about the history of the show. So Ryan, let it rip.
Well, it's 2009, and the country was brimming with new ideas, and we were sitting at the health center thinking about all of the reform and innovations that were going on in healthcare, and came up with this sort of notion that perhaps we should start getting some of these ideas out across the country to our colleagues. So the idea of putting together a radio show at the local university's radio station popped up. And we said, well, let's do it.
Wesleyan University had a great radio station, WesU. It had an incredible staff, a great manager. We felt like we were really part of the WesU team.
Who can we grab to come and be our guest on the first show? Nancy Pelosi was coming into the state of Connecticut, the Speaker of the House. She agreed to call in, and to say that we had the Speaker of the House was fortuitous for us. She helped propel Conversations on Healthcare.
After almost 10 years of recording the show at the WesU studio, we had a new building. We built the Knowledge and Technology Center at 19 Grand Street and designed a studio to serve the purpose of recording the radio show, but of course it has turned into so much more through the incredible work of the studio team.
We realized that this was an opportunity to talk with people far and wide, whether it was talking with Dr. Fauci or talking about the latest in science innovations, Dr. Topol. We're continuing to bring new people on, people that you would see on CNN, MSNBC, were calling us up and giving us the opportunity to highlight the work that they were doing.
Dr. Osterholm, a regular visitor to the show, Dr. Vivek Murthy spoke with us on the show. Also, some of the folks who were in Congress, certainly Senator Murphy, Congresswoman DeLauro, Congressman Clyburn.
We also want to usher in the next generation of guests and hosts that will make a difference for the people who work for us and the people who come and depend on our services.
Great. Well, thank you. Thank you guys for running the video clip, and hope that gives you a little bit of sense. I also call it hairdos through the ages, you know, as you move from one decade to the next, as we've done now with this show. But I wanted to talk now more about, you know, in all seriousness, why we did it and how this has played out. And I'll make a few more comments after I go through some more slides of the people that we've had on the show. We really took this as an opportunity to make sure that messages, information, opinions, thought leaders were out there and had an opportunity to speak in an environment where they weren't being debated. It wasn't a debate show. We knew we controlled the pulpit. We edited the shows and we wrote the scripts and we wrote the questions. So we knew we could have a reasonable level of control. But we wanted to give the people who we asked to be on the show, who we respected, didn't always agree, but respected, we wanted to give them the opportunity to have a conversation that got at the heart of the subject that we were interested in, but wasn't a gotcha show. We were always very clear, not a gotcha show. We sometimes redirected conversations, but we hoped that we were putting information out there for our listeners, which have been in the thousands over the years, up and down from when we were on public radio and iHeart to the podcast, which has kind of seemed to become the most common way that people take a look at it. Obviously, some pretty big events happened between the time we started the show 15 years ago and now. There was the election that had just happened when we started it, with President Obama being elected. There was the Affordable Care Act. We were still recovering from the economic recession as we moved through, I'd say, the 2010 to 2020 years. A lot of reform was going on in terms of healthcare, in terms of healthcare design. I think we all had a chance to live through some really interesting times, and many of us as former fellows had a chance to lead during those times. And then we, you know, crested up on this issue of COVID in 2020, and COVID became something that we felt very proud to be able to use to get opinion out there. We'll talk about him a little more in a minute, but Tony Fauci had been on our show talking about his work with HIV/AIDS, which I had admired from the early 80s when we first confronted it. But he became a regular on the show. I've been saying, if you're a Saturday Night Live fan, I need to get him one of those jackets like they have for the five-timers that present on Saturday Night Live. But he's been on the show 9 times, and most of those were during COVID, and then a few since COVID and since he's written a book. So some of the early people after Nancy Pelosi and Mitch Katz, actually two next people that came up were both people in nursing. The retail care clinic industry, Minute Clinic retail care was new still at this point, not brand new. Minute Clinic had started in Target back, I think, when I was an RWJ fellow. But it was really gaining steam, and this is before there was an urgent care clinic on just about every corner of every affluent zip code in America. We had the leader of that on the show, Sharon Rising, who started the Centering Pregnancy model, did the original research on that, joined us on the show in 2009 as well. Next slide. We moved into science and administration, the Human Genome Research Project, which Francis Collins had done the leadership work on, which would lead to the All of Us project right around that period of time. We've had people from the All of Us project on, really tried to advance people's exposure to understanding what was going on with that project, which we thought was so important for people in our country. Had many administrators from Medicare and Medicaid services, always focused on the policy issues and using our questions to highlight the things that we thought still needed work and to see what they were doing about them. And certainly the way Medicare has evolved, I think, over these last few years has showed a lot of creativity, and we've had a lot of nurse leaders involved in that. We had Tom Frieden on as director of the Centers for Disease Control and Prevention. We've previously known him in his work as the commissioner of New York City, and subsequently have engaged with him around some of his prevention work that he's doing now globally. Next slide. I dropped in a lot of COVID slides intermittently so as not to overwhelm you with COVID, because I know it's in the rearview mirror. But we had a lot of people with a lot of perspectives on COVID, on the COVID vaccine, on the best way to manage the pandemic, really trying to stay with let's get information, let's get opinion on what might be the best strategies to get the information out and to get the science out, but really staying with the science on this from both a mental health perspective, an epidemiology perspective, and also what it offered us an opportunity to do in terms of innovation. Next slide. Over the last couple of years, we have certainly used the opportunity to have multiple shows about the erosion of reproductive rights in the country. We'd had Lena Wen on before all this, who headed up Planned Parenthood, had been in Baltimore as a health commissioner before then. I think she's been on the show a few times. But as things really began to change in this arena of reproductive rights, we thought it was really important to have people who could speak to that issue. I'm not sure everybody has said yes to our invitations to be on the show to speak to this issue. And I should add, we have a policy, we don't give the questions to guests in advance. That's just, I think, a good journalistic principle. So not everybody says yes to the invitations, I should say. Next slide. We also did a show specifically on the IVF fallout, and this was a completely fascinating show to me. If you're paying attention to which ones you might want to think about taking a look at, this explored the issue in ways that I had really not understood it, and very informative, I think, for the public and for the country. Next slide. Dr. Fauci just joined us recently in June to talk about his new book. That was his 9th appearance. He was on first for HIV/AIDS, and then PEPFAR, I think, and then multiple shows talking about COVID. By now, when we interviewed Dr. Fauci, he was at a point where, of course, he had many personal threats on his life. We had a chance to interview him in person. I think I have some slides of those, always accompanied by 4 or 5 security people. Really very telling just what it cost him to be so clear about his the science and his perspective on what we needed to do and what was really going on with the COVID pandemic. So really powerful to have Dr. Fauci really become somebody we considered a friend as well as a interviewee. Next slide. One of the advantages of doing something like this is that you actually get press credentials. I didn't know that when we started down this path. The press credentials first got us into the Democratic National Convention in 2016, which was a lot of fun because we were the producers of the show Conversations on Healthcare, so that was kind of a fringe benefit. We really enjoyed that. And then we were invited 2 years ago, so we've now been back twice to the Aspen Festival of Ideas Health, which if you ever get a chance to go as a speaker preferably, or press, because it's frightfully expensive to go as an individual person, I've learned. It's a really amazing place to meet a lot of thought leaders in health and healthcare around the country. Next slide. During our visits to Aspen these last 2 years, we had a chance to interview Admiral Rachel Levine, most high-ranking person in government who's openly transgender, I think she would probably say. She just is amazing and shared her story and her history, along with primarily her commitment to the country in her role in government, and I thought had just tremendous and insightful insights that we were very happy to bring to the country. In that same visit to Aspen, we had Greg Jackson, who is in the White House office, focused on gun control and spoke to what the Biden administration was doing to try and reduce gun violence. He himself was somebody who, on an evening out with friends in Washington, D.C., was caught as a bystander and shot and very seriously wounded. He knows of what he speaks, and that was one of the really powerful shows. Next slide. We've had a lot of guests who helped us bring forth the issues that we're concerned about in terms of mental health and behavioral health. We've had them from professional societies. We've had them from the clinical perspective. We've had them from thought leaders. And the top one was one of those that was very interesting to bring forward to people. We also had the head of the American Psychiatric Association on pretty recently. The lower one, another key topic for us was health disparities and how we could shine a light on both the science, the reality, and the consequences of health disparities, of racism in the United States. Obviously, from George Floyd in 2020 on through, this has been a major area for all of us in terms of concern. And the lower panel was really focused on identifying also the extent of health disparities, even when it came to children, which somehow as much as I've been around, I shouldn't be so surprised anymore. I still found shocking that children of color receive worse treatment than their counterparts. Next slide. We rarely, I'm not sure exactly why, but we rarely have dipped into our own amazingly talented staff. We have a staff of about 1,800 or so, I guess, at Moses Weitzman Health System at this point. But Dr. Titiana Arma on the left and Dr. Amanda Calhoun on the right are two people to pay attention to in psychiatry. They're both amazingly brilliant, prolific writers, researchers. Dr. Arma leads our entire behavioral health and psychiatric division. And Dr. Calhoun has joined us just on a limited basis, but they are deeply, deeply committed to identifying, addressing, and eliminating racism and health disparities in mental health and psychiatric treatment, and we're very, very proud to have them here. Next slide. We have occasionally gone back and looked and said, who are we missing? What groups have we not focused on enough? Both by profession. We've had nursing, medicine, public health, dentistry, psychiatry, behavioral health, community health workers, social workers, tried to cover a lot of the health and helping professions. But we've also looked at it from the racial and ethnic, gender identifying populations. And just, we don't have ratios and we don't, keep count, but we do try and make sure that we're paying attention to people from all backgrounds. And Dr. Elena Rios was one of the really wonderful people that we've had on the shows. We've also brought journalists on, and we've decided the best way to have journalists on the show is to have 3 of them at one time in the room, and to be able to get them to go back and forth with each other, sometimes from a conservative and sometimes from what's considered a liberal publication, but journalists make great interviewees as well. They've given a lot of thought to what's going on and to their writing. Next slide. We would have been remiss if we didn't have environmental leaders on. Dr. Vanessa Carey Delves, who's in a family of people well known to everybody for their environmental activism, joined us to speak about the experience of the United Nations Climate Change Conference that she had been participating in. And on the lower slide, just a great presentation from two authors who were really focused on how do we get more Latinas interested in nursing and laid out their ideas and inspirations. They had some amazing stories, and we were very proud to have one of our staff persons who was contributing to their book. Next slide. Scientists, innovators, entrepreneurs, more COVID, Dr. Eric Topol, I think one of our major sort of science thought leaders, Dr. Zeke Emanuel, who many of you will remember from back during the Obama administration, and Michael Osterholm, who, like Dr. Fauci, became kind of a regular on the show during the COVID period, always an interesting perspective on where we were with epidemiology, with vaccines, but also with public reaction and the way our organized healthcare systems should be responding, could be responding to the COVID pandemic. Next slide. And I think this might be my last slide. Don't worry, wasn't gonna show you 750 slides. Those were just a queuing up of some that I thought you might find particularly interesting. And I thought I'd end with the JAMA editor talking about rebuilding trust and also how to engage more people in reading the information that's being produced. She was wonderful. Dr. Bibbins Domingo took over, as I said, at a tumultuous time and has a really clear vision for how JAMA should deal with health equity in particular and the public's lack of trust. We say here in healthcare, but I think it's lack of trust in medicine first and foremost, because as you all know so well, nursing remains the most trusted profession of all. I think I'm going to wrap up this section right now, but if we'll go to the next slide for just a minute, do some summaries here. So we still have some radio shows. We still have podcasts that's available on Facebook and YouTube and X, Healthcare Now Radio. If you're not already part of our tens of thousands email blast list, we'd be happy to add you to it. I know you all need one more email coming in. But if you'd like to have access to the show, we've tried to make it as widely available as we can make it. Next slide. And you can just go on to the next one. Thank you. Okay. I did want to go back and highlight some of our interviews with nursing leaders over the years, just for this group. Certainly people from the American Nurses Association, some of the presidents, Jennifer Kennedy, Ernest Grant, Rebecca Patton, I think we might have had on twice, Mary Jo Ossie, Director of Nursing Practice at ANA, Sharon Sprinkle, co-director of the nursing practice at Nurse Family Partnership, Jackie Campbell, who I know many of you know, Bev Malone, and also, although the print shouldn't be small there, but I put that in myself, others that you know from the RWJ Fellowship, Jenny Chin Hansen, Sue Hassmiller, Ed O'Neill, Donna Thompson, and others. Next slide. Probably our highest rated shows. You never know what's going to really draw attention. I would say Renee Fleming, who most of you may know as one of America's most famous opera singers, just has an amazing book out on music and the mind. And she's partnered up with Francis Collins to do research on the impact of music on the mind. We all know it intuitively, but she's doing some amazing work with him, and that really captured a whole different audience. Jane Pauley, who you may know as having been a morning anchor for many, many, many years the 6 a.m. slot, I think, before she stepped down from that. But also, I was very frank about the history of behavioral health issues that she had experienced and her family had experienced, and has been a real advocate for community-based behavioral health, including in community health centers. Jane was a very popular show. Mark Cuban needs no introduction. I think we have him coming back on the show. Very disruptive innovator. Really encourage you to take a look at those shows. And we've had many senior members of the Biden administration over the years, and I'm certainly hoping we get invited to go back to Aspen next year. Next slide. So some strategic considerations that I wanted to leave you with. One is impact. If we weren't able to attract an audience, if it just didn't land, would we continue to do this? Probably not. But we know it has an impact. We know it has an impact from the feedback we get from the extension of our own network and sphere of influence of how many people we connect to through the interview, to what we're thinking about in terms of our healthcare professions, our healthcare systems, policy, and policy even beyond healthcare. So we think it does have an impact, only probably in the arena of giving people additional food for thought and sets of resources, and connecting them to other people who are interested in these issues. We think it's a public good. Anytime you can have a civil conversation these days with people who are very much in the public sphere, like Tony Fauci and others that I've mentioned, we think that's a public good to be able to have those conversations. Shining a spotlight on some of these key issues like reproductive freedoms or what was happening with IVF. Even some of the things within the professions we think has been really important. We do take the opportunity to incorporate key messages into each interview. As you might imagine, there are certain people when I'm interviewing them that I'm going to be a little bit on the alert for how they might reference the profession of nursing or nurses, or issues like, independent practice and things like that. So I'm always on the alert and take the opportunity to rephrase the question or give it back with a more perhaps enlightened view of what we're discussing. I just consider that one of the prerogatives of having the microphone. And then there's the cost-benefit considerations if you're going to take on doing something like this. Obviously, it is not a small undertaking. You see the studio, you've seen or met our staff, from the producers to the folks who really get us ready every week to do the shows. What's the benefit of an organization which states proudly we are a community health center, that our mission is healthcare is a right, not a privilege? That means that we're also engaged in research and training and education and policy. What is the benefit of that on the national scope? Well, I think that has a very high, probably positive return financially, but it's not to us. We hope that we're enlightening and building value throughout the country by doing these shows, and we're willing to take on the cost. We're not funded by a philanthropy. We don't get grants to run the show. We never have. We really take this as bottom line margin and make the investment with it, and think it's an investment well worth making. I think that might be the last slide. So I will, last slide, Ryan, all set? Yes, perfect. So we can come back together maybe for conversation or some questions. I know Warren has ideas about how he moves people into triads, but I'd be happy to also answer any questions that people might have.
Yeah, let's do that first, Margaret. And the first question for me is, you use the word impact. 15 years. Wow, congratulations. And how many different, did you say 500 and some?
750-ish.
Wow. So
Yeah.
How have those 750-ish, 15 years impacted Margaret Flinter? How has your perception of Margaret changed and your ability to impact healthcare?
That's worth thinking about for a minute. I get tremendous enjoyment out of the show. I love to talk to people. When we first started going down this road, I remember thinking to myself, whoa, we get to call up all the people that I've ever really wanted to talk to and have a 30-minute conversation with them. How amazingly cool is that? And that really holds true today. I don't think Tony Fauci probably would have talked to me 9 times for half an hour over the course of these years, even though I've admired him, as I said, from the HIV/AIDS days. The leaders in policy, certainly in government, the innovators, the people who are doing really just amazing and cool work, to have that level of connection is terrific. And we don't regularly pursue follow-up with people. We don't use it as an opportunity to then, market something that we're doing. But we now know a lot of people that we wouldn't know without the show, and we do encounter these people in the public sphere and email or see them on Twitter, follow them on LinkedIn. And I will say, not impact on me personally, but on the profession as a whole. It's not lost on people, I don't think, that Mark and I come from this background of founder, president, and CEO of what has become one of the largest health centers in the United States, and a tremendous activist, and also a person who's an executive leader who is a nurse practitioner, and a community health person by background. I think that's a real positive. I don't know of another show that has that kind of combination.
Great. Kate Fyatt, you have a question. Why don't you come on off mute and join us?
Margaret, I've always admired your work and admired
Kate.
your ability to move forward with this. And I'm wondering about what advice you would give our younger colleagues on how to do what you've done, successfully stand up and stand out and make your innovative ideas a reality.
Yeah, it's a good question. Well, I would say that I stand in awe of today's generation and their absolute lack of any reserve about getting out there, whether it's TikTok or self-created videos. I think, I don't know if everybody here had Edith as a coach in the Executive Nurse Fellows Program, but she had to really work with a lot of shy people. There are a lot of shy people in the RWJ Fellowship when I was in it. Anyway, but I think the current generation is skewed much more towards being comfortable with these things, putting themselves out there, perhaps more comfortable with public speaking generally, may not have had the opportunity to do this kind of back and forth, which is a different level of communicating, right? When you've got another person that you're communicating with. So I think my advice, if you're interested in, is do it on some level. You don't have to do it at the macro level that we've done this show. The technology has become very democratized. You can create your own. God knows I don't watch much of it myself on TikTok, et cetera, but God knows people have shown us that you can create whatever content you want. If you want to do it professionally, as we have done it, I think it's a great question for people who are in practice or leaders in any profession, but I'll just talk about nursing, given that we're here in the Nurse Trust meeting. The media doesn't often ask for our opinions, in my experience, unless there's, some sort of major, front page news story. And you can wait for them to ask our opinion, or you can go and put your opinions out there in one form or another. And this is a particularly pleasurable form to do it in. So I think people should find their vehicle that they're most comfortable with, engaging in a public way, and engaging in a dialogue. Conversation is a wonderful thing. Arguing is not so wonderful, but conversation is a wonderful thing. I think we've, certainly all lived through a period of time this past year when you wonder if anybody's talking to each other as opposed to talking past each other. But I hope that we have demonstrated, and I hope that people coming up into the profession today will really think about how important it is to also model up, tough subjects and talking about them in a way where people can be conversational, express their opinions, beliefs, and knowledge without fighting about it.
That's I I appreciate the idea of the micro level, and I want to share a story about when COVID hit in March of 20, some colleagues and I got on and started a Facebook Live stream every Tuesday evening, and we did it for 2 years, targeting the North Omaha predominantly African American community, and it was very informal. We did Zoom, and we're sitting in our homes, but we brought in the health department and ER doctors and all sorts of people. It was very well received, and so you're right. I
That's
mean, and
great.
this was very low tech, very, and
Yeah.
when COVID was over, but it really, I attribute it to some degree for the fact that this particular community did very well with COVID.
Well, I really applaud you for that. And, every generation should take advantage of the tools that's been given. When we were fellows, Zoom was something you did in your car, press the gas and zoom and off you went. But there is this possibility to bring your message to the larger community. We had a very similar thing in this town that I'm in right now, Middletown, for the first 2 years of a team that included our mayor, the health department, but also the person in charge of recreational activities for the city. What was that person doing to make outdoor fun activities available? Included our chief behavioral health officer to really, in every show, provide just some incredibly wonderfully insightful, reassuring messages about how to talk with your kids, get through this time. And Mark, my colleague here, was on that. And people, it was like incredibly highly watched by this community, just like the one that you described.
Yeah. Well,
Kate.
and one of the
people were
key
so
people-
hungry for that connection.
Yes. And one of the key people for us was a very well-known pastor in the community. And she was there and so that really made and brought the churches in, and it was very effective.
Do we have any other questions, Margaret? If there's something that's burning, and after another question or two, we'll move to our triads. Margaret, I'll make a comment while we're waiting. You've done an extraordinary job. You've used the term civil conversation a few times. The degree of vitriol that we've experienced in our conversations over the past few years has been very disturbing. Is there a particular thing that you and Mark have done to try to keep the conversation civil and without naming names, or maybe if you need to name names, was there a time or two when that was challenged?
Very, very, very rare. And again, we're not doing these live, so we really don't worry about it too much. We can always, if we had to, we could always just press delete, not air the show, etc. I will tell you, I won't use names here, but I find this amusing because it seems like such a superficial thing. But a certain rather high-level government official was publicly chastised in the newspapers for the cost of her hair and makeup sessions prior to any public interview. Now, I found this interesting because I will tell you, when we went from the old radio station and just being on radio to this, and suddenly I had to actually think about, hair or makeup, that was not a happy day. I mean, I really liked the old radio thing where, I could make faces and didn't have to think about how I looked. But this particular government official, we decided to ask about it because it was in the news. And oosh, it was like pressing the proverbial abscess. That was not good. We deleted some of that. But generally speaking, on a more serious note, you could tell by people's voices if they were unhappy or angry, but people don't get to the kind of positions that they're in, and they don't get invited to be on a show unless we have some sense that this is a reasonable person to talk to, which is not to say we agreed with everybody, and there were some notable ones, but we work our way through, always with respect. And I just think that is, would that people gave up fighting for ratings with their shows and really focused on respect, enjoyment, communication, knowledge sharing. I guess it would be less entertaining for some people, but that would be my goal anyway.
As is often the case, I try to bring in a lot more conversation. I thought we were ending at the half hour, and Tracy's letting me know that we're scheduled to wrap at 15 minutes after the hour. So maybe we don't have time to go to the triads. I really like to do that to give you a chance to visit with everyone else. So maybe let's do that. Tracy, if we could go to triads, even if it's only 10 minutes. And back to the radio versus video, I did a radio program for family caregivers for 16 years. And I loved saying that I had a face for radio. So, the prompt that we'll give you, Tracy's going to break us into triads, and we're going to go for 10, or if you can stretch it to 15 minutes, and then we'll come back. Tracy, I'll trust you on whatever time you have. But the prompts that I have, and I'll put them in the chat, is how has this presentation impacted your own perspective on your need to communicate in your own communities, in your own institutions? So how has this presentation that Margaret's given give you an impact of how you might communicate? And the second thing is have you impacted the trust of nurses through your communication? As I indicated, I'll put those things in the chat, but what we'll do now is Tracy will break us into triads. I've got three little sort of things that we follow in some of the work I do is listen from the heart, speak from the heart, feel free to be spontaneous. If something pops into your mind, it's there for a reason. So just allow that out. And then the last thing, which is hard for some of the guys groups I'm in, and that is to be lean of speech. Because we've got very little time, make sure to be considerate of the other people in your group and give everybody a chance. So listen from the heart, speak from the heart, be spontaneous, and be lean of speech. And I'll put the prompts in the chat. Tracy, go ahead and move us to triads whenever you're ready.
Hi, Deanne. Welcome back, everyone.
Good to have all of you with us. And I think that Mary Joan has some things to share. And Tracy, you got some other things for us.
Yeah, I think if you don't mind, maybe we'll turn it to Mary Joan and to talk about our fellowship program.
Great.
That's great. Thank you so much, Margaret. And thank you to the two folks I was in my small group with. We had a great conversation, and I think we had some similar kinds of ideas. So, and Margaret, you really started a lot of thinking. So thank you. Tracy, do you have some slides? So I'm again, Mary Joan Ladden, nurse practitioner, president of Nurse Trust. And I wanted to take this opportunity to talk with you about the Nurse Trust Fellowship Program. This is our third cohort that we're recruiting for. And the first two cohorts, we had 17 in the first cohort and 24 in the second cohort. And we're focused on emerging leaders. And emerging leaders is really a term for those that are either beginning in their leadership journey or starting in a new setting or a new area. And you can see the rave reviews that we have from Yolaine here. The deadline is October 16th, and it focuses on very key competencies that you can see here. And what's unique about this fellowship program are several things. One is that it's across sectors. So many other fellowship programs focus on a setting, like health systems or academia or community. We have folks in emerging leaders in the program who are across all settings. So you really get an opportunity to look at solutions and innovations and meet colleagues from very different sectors. We collaborate with the Center for Creative Leadership, which is in Greensboro, North Carolina. CCL is really a global leader in leadership education, has programs from emerging leaders to leaders at the peak, which is generals in the military. It's an 8-month virtual program that is facilitated by CCL and focusing on these competencies that you can see on your screen. But it also is bookended with an in-person meeting in the beginning and an in-person meeting at the end. And those are at our Nurse Trust annual summits. And this really also a very unique factor is the mentorship. So you have two mentors. You have someone who's internal in your organization who can help you navigate the organization, but also someone who's a national leader and a experienced mentor in an area that you're in or that you're interested in getting into. And we're calling it emerging leaders. We actually have 3 levels. We have emerging, experienced, and executive. We've continued the Emerging Leader Fellowship Program this year because we know that there's many senior level executives, senior level leaders are leaving or are really passing the baton to those that are maybe earlier in the leadership development process. And they're passing it to folks who want to be leaders, but maybe have not had the opportunity to have formal leadership development experiences. And this really is a way to do that. Applications are due as soon as possible. What I'd advise is if you're interested, take a look at the website, nursetrust.org. Look at the application, think about it. Think quickly, though, about it, but also speak to others, Yolaine or others who have gone through the program, and speak to someone in your unit or someone who's been a mentor to you to say, I'm looking at this program, help me think about how this program can help me. There's a key leadership challenge that is part of the program. And I think the leaders who have gone through the program have felt that it's really helpful in crystallizing something that you're dealing with in your setting. That's a really thorny leadership issue that this program and your mentoring and others will also think about how you can solve it. So you may be interested in the program, but any of the people who work with you, any of your colleagues, any of those that report to you may also be interested in the program. So think about it. It's on the website. It gives much more information than what I was able to do, but thank you.
Thank you, Mary Joan. Tracy, anything else that we need to add before we depart?
I think we're good. Yeah, thanks
Great.
for asking.
Margaret, thank you so much for bringing such an information-filled and uplifting presentation to us today. We really appreciate you and look forward to seeing you at some other Nurse Trust gatherings in the future. I know you're hoping to make some.
Absolutely. It was lovely to be with you all. Thanks so much for the invitation. Bye-bye.
Thank you.
Thanks, everybody. We appreciate y'all being here and hope that you have a good remainder of the week.